Texas is denying children access to life-saving procedures, critical care, and other essential health services. The state specifically doing this by mass purging millions of people from their Medicaid rolls, causing many people to just lose coverage even when they're still eligible. And now, because of the sheer number of people who have wrongfully lost coverage who are trying to get it back, Texas's Medicaid offices have been completely overwhelmed, meaning that people who improperly lost their insurance have to go without coverage for longer periods, sometimes waiting months at a time. And all of this as the state's medical system is being strained by the large population of newly uninsured. And here's the kicker, a new investigation by ProPublica and the Texas Tribune has found that it was completely preventable. So for some background here, during the pandemic, the federal government paid states billions of dollars to not kick people off of Medicaid and make the health crisis that much worse. So as a result, Medicaid rolls grew astronomically nationwide. I mean, just in Texas alone, the number of people receiving those benefits increased by more than 50% to 6 million. But in April of 2023, the federal government stopped requiring states to keep everyone enrolled, with them leaving it to the states to determine who was still eligible and who needed to be removed, a process that is commonly known as Medicaid unwinding. And I mean, right from the get-go, federal officials were worried about how this unwinding would impact vulnerable Americans, like the millions of low-income people who rely on Medicaid for healthcare. So in order to prevent poor families from losing coverage, the Federal Centers for Medicare and Medicaid Services, CMS, issued guidelines instructing states to move slowly and carefully. But Texas did the exact opposite, instead working to remove as many people as possible as fast as possible. And those efforts were unprecedented, right? According to the nonprofit health organization KFF, Texas purged more residents from Medicaid than any other state, with officials disenrolling a whopping 2.5 million people in total. And yes, Texas is the second biggest state in the country, but it still removed more people than it kept on the rolls. But, and this is the key thing here, the key thing to take away, the vast majority of those people who were removed, it wasn't necessarily because they were no longer eligible for Medicaid, with KFF finding that nearly 7 out of every 10 Texans stripped of their insurance were disenrolled for administrative and bureaucratic reasons. Things like failing to return a renewal form or filling one out incorrectly, or because of issues on the administrator's end, like when a state Medicaid office doesn't have up-to-date contact information and can't reach people to tell them, hey, you need to resubmit to qualify. And that kind of procedural shit, it happens all the time. But when you're talking about it happening to 1.7 million people, you have to wonder if there's a bigger failure with how the system's being administered. And that is exactly what ProPublica found in its investigation, with the outlet reporting that it viewed dozens of public and private records which clearly show that those and other mistakes were preventable and foreshadowed in persistent warnings from the federal government, whistleblowers, and advocates. Right from the very start, Texas decided to go against multiple key federal guidelines. Like for example, federal officials encouraged states not to review more than 11% of their caseloads each month, arguing that doing any more could overwhelm their Medicaid systems and cause eligible people to be removed. But just in the first month of the unwinding, Texas reviewed nearly 1 million cases, 17% of its caseload. Within 6 months, the state had launched reviews of around 4.6 million cases. But arguably, the most significant federal guidance Texas ignored was the strong recommendation that states automatically renew eligible residents using existing government data, or using information like tax records or quarterly payroll data employers report to determine how much money a family makes and if they qualify. But instead, Texas, for some reason, forced nearly everyone to resubmit documents to prove that they were still eligible for Medicaid, which is a big part of the reason so many people were removed for administrative reasons, like failing to provide the necessary documents in time. But also, Texas didn't just flout guidance, it repeatedly ignored numerous direct warnings from the federal government. In fact, according to ProPublica, just 1 month into the unwinding, the federal government pressed Texas on why it was moving so damn fast, and officials responded by downplaying the concerns. Then, a few months later in July, U.S. Health and Human Services Secretary Xavier Becerra urged Texas and other states to automatically renew more people using existing government data. Also, that same week, a group of employees anonymously emailed the leader of the Texas Health and Human Services Commission, with them claiming senior management had informed them that tens of thousands of people had been improperly removed from Medicaid thanks to the agency's poor handling of the unwinding. But it also doesn't end there, right? In August, CMS explicitly asked Texas to stop requiring eligible people to resubmit documents proving they still qualify, with them noting that it appeared that many people weren't even aware that they had to re-enroll, couldn't understand the forms, or faced other issues. And at around the same time, numerous advocacy groups, health providers, and newspaper editorial boards began urging the state to pause its harmful unwinding and make sure that people weren't incorrectly losing their insurance. But Texas just kept ignoring, and the problems persisted, with things getting so bad that back in December, Becerra appealed directly to Texas Governor Greg Abbott and 8 other governors of states with the highest shares of children who had lost Medicaid coverage. And Becerra writing that Texas alone accounted for nearly 1/4 of all American kids who lost federal insurance during the unwinding, and once again, urging the state to follow federal guidelines. But Texas, like the others before it, ignored that final plea, with ProPublica writing, the decision to buck the federal government guidelines was one of many that led to serious repercussions for Texas residents who rely on the program. And as the outlet noted, that decision was especially devastating because the state already has so many restrictions on Medicaid that make access so much harder. I mean, Texas provides Medicaid to a smaller percentage of its residents than almost any other state. And it's also one of just 10 states that never expanded eligibility after the passage of Obamacare. And that, thanks in part to Greg Abbott, who helped successfully sue the federal government to make sure states didn't have to cover more residents when he was a state attorney general. And so as a result, the state's program is seriously limited and mostly only applies to children, pregnant women, and disabled adults. But poor adults usually aren't eligible unless they have kids, and even then, the threshold is super low. Parents who have 2 kids only qualify when they have a combined income of under $285 a month. Though oftentimes, kids can still qualify even if their parents don't, which is also why when the state mass purged its Medicaid rolls, most of the eligible people it hurt were children. And the impacts of that are insanely consequential, with one pediatrician telling ProPublica that children have been forced to postpone or even totally forego life-saving operations like heart surgery. And critical care has also been unnecessarily cut for kids with severe diseases like sickle cell anemia, as well as those with autism or other developmental disorders. And while crucial care is obviously the most serious repercussion, any lapse in healthcare coverage also hurts families who just need regular everyday care. Which, you know, is exactly what happened to people like Michaela Hoops, right? I mean, her kids have been on Medicaid all their lives, but they lost their coverage during the unwinding. After years of never having to renew their coverage, Hoops was confused when she was required to reapply and miss the deadline. So Hoops was forced to frantically apply 7 days after the coverage lapse. But then, because the Medicaid system was so bogged down with all these people who wrongly lost coverage reapplying, it took over 100 days for their insurance to be restored. And in those 100 plus days that the family went without insurance, Hoops had to take her oldest son to the emergency room for a serious migraine, a visit that ended up costing $3,000 that she and her husband couldn't pay. And then a few months later, the 14-year-old broke his nose, and while she paid a few $100s out of pocket for the doctor, she couldn't afford the CT scan needed to reset his nose, which was just left to heal crooked. And while Hoops' family eventually got their health care back, there are many other people who went through the same thing, being forced to reapply and wait long periods of time without insurance. And according to the state Medicaid agency, the median processing time for applications is nearly 3 months because of the strain this mass purge has caused. And that's also way more than the federal limit, which is 45 days in most cases. In fact, the wait time situation is so serious that CMS launched an investigation into it back in May. But then also the consequences of Texas's decision go beyond the human element, with ProPublica explaining. The sudden suspension of health insurance for a population the size of New Mexico has had additional ramifications in Texas, including higher treatment costs for hospitals and clinics forced to take on more uninsured patients. Right? Texas Children's Hospital in Houston, right, the single biggest pediatric hospital in the country, they had to lay off employees because of major budget shortfalls caused in part by the loss of Medicaid patients during the unwinding. And statewide, some safety net clinics reported a 30% decrease in Medicaid revenue, forcing layoffs, furloughs, and cuts to certain health services. Also, at this point, if you think things can't get any shittier, sorry, turns out it can, because Texas uses the same eligibility system to process applications for both Medicaid and food stamps. So some families who were pushed off of their healthcare also lost their food benefits, and they're having to wait over a month for that assistance. And so ultimately, we just have this huge fucking mess. And as far as what happens from here, unfortunately, there's really not that much that can be done to help all these people in the healthcare systems that Texas has hurt, at least right now. Really, I mean, like, the only glimmer of hope for accountability is the federal probe into the long wait times. And even there, while federal officials and health policy experts say that is a solid step, there are very few options for CMS to actually hold Texas responsible. You have experts saying the agency could pull federal funding, but that could result in low-income people losing health insurance and open the government up for a lawsuit. And this also, as that probe probably won't go anywhere if Trump wins in November, because he's encouraged states to restrict Medicaid and vowed to repeal Obamacare. And so for now, we're gonna have to wait to see how multiple things play out. And in the meantime, of course, I'd love to know your thoughts, especially if you're someone who lives in Texas. Hey, thanks for watching, and I hope you enjoyed this clip from the full Philip DeFranco show. And also, a big thanks to Squarespace for sponsoring our Clips channel. Turn your passion into profit over at squarespace.com/Phil, or use the QR code. Because whether you're launching a business or a lucrative side hustle, your website is your digital business card. It's the only space where you control the story, no algorithms or distractions. And with Squarespace, it's so easy because they got a ton of stunning professional templates with drag and drop editing that makes site design incredibly simple, no coding required. So get started for free at squarespace.com/Phil, or scan the QR code on screen and use code Phil for 10% off when ready to launch. Squarespace.com/Phil.